You know, Alan Wolfelt is one of the premier grief specialists in the world today. And when he found out that the DSM-5, the Bible for therapists, is going to include something called prolonged grief disorder, he went a little bit ballistic. He was very upset because as he sees it, we are applying a medical model to an emotional situation that happens to everyone on this earth.
Well, welcome to Grief and Loss Today. My name is Donna Brandenburg.
And I'm Andrea Harris.
And we are talking about prolonged grief disorder as it relates to
the new DSM-5, which is coming out in 2013.
Okay.
And is going to affect a lot of people who are grieving.
Tell us about the struggle between looking at it one way and looking at it the other way.
Well,
there really is two camps.
There are two camps, very much so, and there are valid issues on both sides of the question. The DSM-5 seeks to, what I would call, pathologize grief. In other words, to make it an illness rather than a normal situation that happens to every living human being. They also seek to do it in kind of a hurry because grief takes time. And if people are looking at you as having an illness or disorder within a few months of a death, very few people are going to not be diagnosed that way.
Mm-hmm.
And so that validates people's feelings that, oh, there's something wrong with me. And there isn't. There's nothing wrong with people who are grieving. Now, for some people, they do need some extra help in getting through a very tough death.
Mm-hmm.
And they may sink into some depression. And having a diagnosis in today's managed care world allows therapists to bill for it. And so that's the other side of the spectrum.
Mm-hmm.
Many of us believe that isn't a good enough reason to cause people who are having a normal response to an abnormal situation, having someone you love die, causing them to feel like there's something wrong with them. So the battle has been raging for some time now, and probably will continue even after that issue of the Bible for therapists is out.
So what I'm hearing is that there needs to be something done in that arena to help people get the help that they need, but maybe this isn't the best approach to getting to the end goal.
Right. There are some diagnoses that, if someone's not adjusting to a situation, needs some extra help, there are diagnoses in the former book that can work and have worked for decades. So I seem to come down on that side of thing. There's nothing wrong with grieving.
Mm-hmm. It's a process because death is part of life, and living, it's a complex chain of events.
Yes, it is.
Yes. Well, we're talking about an article, Prolonged Grief Disorder, from Dr. Alan Wolfelt. And we encourage you to look around at our site for more resources if you are a professional dealing with or somebody that's a bereavement specialist. We want to be of help to you to help the people that you're taking care of. It's our job to help you grieve and also help those around you.